Good day, this is Dr.K Gireesh, physician, neurophysician and neurosurgeon, and the former professor of neurosurgery and former associate dean. As a part of the continuing medical education program being organized by Padma Clinic and Nursing Home, Chennai, today I am going to talk to you on the part 3 of dementia. Part 1 is the definition and the varying symptoms and signs, which I have said already. Part 2 is the causes of dementia, and part 3 is an overview of the treatment and the care for dementia. One should understand that there is no cure for dementia, but a lot can be done to support those people living with the illness and those who care for them. A lot can be done. People with dementia can take steps to maintain their quality of life and promote their well-being by being physically active, taking part in activities and social interactions that stimulate the brain and maintain the daily function. Yes, this can be done. There are some medications which have been prescribed or has been suggested for managing the symptoms of dementia, like cholinesterase inhibitors, like donepezil. They are used to treat Alzheimer's disease. NMDA receptor antagonists like memantine are used for severe Alzheimer's disease and vascular dementia. Medicines to control the blood pressure and cholesterol can prevent additional damage to the brain due to vascular dementia. Selective serotonin reuptake inhibitors, SSRIs, can help with severe symptoms of depression in people living with dementia. If the lifestyle and social changes don't work, you can actually try that. But these should not be the first option, SSRI inhibitors. If people living with dementia are at the risk of hurting themselves or others, medicines like haloperidol and risperidone can help. But these again should never be used as the first line of treatment. Now, when you have certain early or mild cognitive impairments, there are some things which can do as to care for ourselves. They can manage those symptoms. Stay physically active, number 1. Eat healthily. Stop smoking and drinking alcohol. Get regular checkups with the doctor. Write down everyday tasks and appointments to help you remember the important things. Keep up your hobbies and do things that you enjoy. Try new ways to keep your mind active by kindling your brain with brain teasers, brain gym exercises and so on. Spend time with friends and family and engage in community life. Plan ahead of time. Over time, it may be harder to make important decisions for yourself or your finances. Identify people whom you can trust to support you in making these decisions and making help to communicate your choices. Create an advanced plan to tell people what your choices and preferences are for care and support. Bring your ID with your address and emergency contacts when leaving the house. So have an ID card with you whenever you leave the house. Reach out to the family and friends for help. Talk to people you know about how they can help you. Join a local support group. Now, these are various ways of, looking after yourself when you find that there are certain mild cognitive impairments that are setting in. It is important to recognize that providing care and support for a person living with dementia can be very, very challenging, impacting the caregiver's own health and well-being. Very important. As someone supporting a person living with dementia, reach out to the family members for help, friends and other professional groups for help. Take regular breaks, especially for the caregivers, and look after themselves also. Try stress management techniques like mindfulness-based exercises and seek professional help and guidance if needed. This is all for those caregivers that is those who are supporting people or persons affected with dementia or any one of those dementing illnesses. So, these are some of the, this is just an overview of the treatment and the supportive care that you can render to these people, and what amount of self-care can an individual do when he finds that he has got mild cognitive impairment like disturbance in the memory and so on. So, that is in brief, a brief overview of the treatment for dementia. Then of course, there may be specific depending upon the particular disease, but this is all that we, a supportive treatment is all what we are rendering to all those enumerated cases which you have disease other than bilateral chronic subdural, a treatable one where you can drain the fluid, and normal pressure hydrocephalus where you can again drain the fluid actually. These are the two areas where we can actually do some treatment, and the others, the supportive treatment will have to be given. Thank you very much.